Welcome back, folks, to Psychedelic Therapy Frontiers, the podcast devoted to exploring the frontiers of psychedelic medicine and what it takes to cultivate a healthy mind, body, and spirit. I'm Dr. Steve Thayer, and today my co-host, Dr. Reid Robison, and I are joined all the way from Brazil by Dr. Bruno Rasmussen. Bruno joins us on the podcast today to talk about the psychedelic Ibogaine and its use in treating substance use disorders. Bruno is an internal medicine doc and a gastroenterologist who's been using Ibogaine to treat substance use disorders for the last 20 years down in Brazil. Bruno helps us explore the ancient origins and uses of Ibogaine, how it's been used for rites of passage and healing. We discuss how Ibogaine treatment is used today for substance use disorders. Bruno talks to us about what the Ibogaine experience is like, and much, much more. I want to thank those of you who have left us reviews on platforms like Apple Podcasts and Spotify, those of you who comment on the YouTube videos, like the videos, subscribe to the channel. All those things really help us. If you haven't left a review yet, and you like the show, go for it. We could use the good PR, and I'm sure you could use the good karma. It's a win-win situation. Without further ado, I bring you our conversation with Dr. Bruno Rasmussen. Welcome back, everybody. Reid and I are here and excited to have Bruno Rasmussen on the podcast today to talk about the miraculous medicine that is Ibogaine. Reid and I have been meaning to do a podcast dedicated to this medicine, but admittedly, we are not Ibogaine experts. So we thought we'd bring somebody on who is an Ibogaine expert, somebody who has experience with it. So thank you, Bruno, for joining us.
Thank you very much for the invitation.
Would you mind just introducing yourself to our audience?
Okay, I'm Bruno Rasmussen. I'm a medical doctor. I live and work in Brazil, and I work with Ibogaine for the last 28 years. I have seen legally here in Brazil. In Brazil, it's legal to do Ibogaine treatments, and I have seen more than 2,000 treatments since 1994. I have known Ibogaine because a person very close to me did the treatment in 1994 and outside Brazil, and I was very impressed by his reaction. So I started to suggest people that I was treating at my private office. Officially, I'm a gastroenterologist, but since I started working with Ibogaine, it catched my life. It was very more gratifying to work with Ibogaine than with normal medicines because it really works. It really gives you a sense of doing something to help people. And I start suggesting people to do it, and we discovered that it was legal to import it here in Brazil. Our health agency is called Anvisa. It's the FDA of Brazil, and it allows us to import it and to use it since we do it in a patient-by-patient basis. I mean, we need to import the medicine to be used to that patient that we want to treat. We cannot buy a lot of doses and have it at the hospital, for example. We need to buy it each time a patient wants to be treated. Here, I live in the state of São Paulo, and here in the state of São Paulo, there are some regulations that make it mandatory to do Ibogaine treatments in a hospital. I work in a public hospital, and we are not, let's say, underground providers. We are above ground providers. I don't know if this word exists in English, but this is what we do.
Yeah,
we do it officially, and it's very interesting to work with Ibogaine. It's very interesting because it really helps people, and people people sometimes are afraid of Ibogaine because if there's are stories about Ibogaine, but if you do it properly, if you follow the protocol, it's very safe to do. I never seen a complication in all these years. Never had fatalities or complications or arrhythmias or things like that. And I think that the reason of this is why we see Ibogaine like it was a minor surgery, a minor procedure. We do a lot of tests before we take all the measures to have the patient in a good condition, a good clinical condition before doing Ibogaine. So I'm sure that that's why we have never had a complication in treating using Ibogaine.
So yeah, it sounds like you approached the medicine. Oh, go ahead, Reid.
Oh no, there's a delay. You go for it, Steve. Finish your thought.
I was just reflecting on what Bruno said in the introduction here, approaching the medicine with all the clinical caution that you would any procedure, any medical procedure, right, minor or otherwise, where you're screening patients, making sure that if there are any contraindications, that those are addressed. But what I'm hearing you say, Bruno, is that in all of the thousands of Ibogaine treatments that you've administered, that it's been safe and generally effective.
Exactly. Ibogaine is a traditional medicine from Africa, and we respect the traditional medicine, the traditional healers. But in the medical context, we must be very rigorous about that. So we really approach it as a medicine, as a treatment. We, as I mentioned, we do in a hospital with all the examinations, the lab tests, and a team of doctors and nurses and everything. We monitorize the patients. We follow all the time what's happening. We stay there with the patient all the time. So I think this is the explanation of the reason that we never see complications in the treatment, and we have a good success rate. Let's say we are used to treat more stimulants addiction than opiates addiction. In Brazil, there is not too much opiates being used. You can see some people using opiates, but the majority of the people that have problems, that have a problematic use of drugs, are using or cocaine or crack cocaine. So our experience is mainly with that. But from time to time, we receive patients coming from the United States to be treated here, because I think because of the, let's say, the legality of that, some people feel more comfortable of doing it legally. So they come here to be treated, and the majority of the patients that come from abroad, they are opiates users. So we are used to work with it, but the majority of the patients that we treat are stimulants patients.
So Bruno, I remember when we had a meeting a little while ago talking about what it might look like to send some substance use clients who are struggling with some of these things your way down to Brazil. And I found it fascinating to hear about your process. I mean, we know how the medical detox works here, and and we do some kinds of psychedelic assisted psychotherapies. So there's some similarities, but I'm wondering if this is how it goes, if I understood that right. Like if someone comes to you for opiate treatment, on Suboxone, they need to switch to something else first. Methadone, they need to switch. And you'll often have people come and withdraw there with you. So because Ibogaine works best when you're in the early stages of withdrawal symptoms. Is that right?
Exactly. And an important thing is that Ibogaine makes opiates more toxic to the system, to the body. So it's important to have the less possible opiates circulating when you take Ibogaine. But it's very difficult to ask for a patient that is addicted to opiates to stop using opiates. That's exactly the problem. So what we do is, first of all, switch long half-life opiate, like methadone, for example, to a short-acting opiate, like morphine, for example. It's the first step, because although it may seem that the patient is using more opiates, because with methadone he can use once a day, and if he's doing morphine he must use 3, 4, 5 times a day. What happens is that morphine is going out of the body very quickly. So what we do is try to switch these medicines while still in the United States, is still outside Brazil. And when the patient arrives here, he is already using morphine, and he stays here for a day or two using morphine. And in the night before taking Ibogaine, we ask the patient to stop using morphine. After some hours during the night, he starts feeling withdrawals. We receive the patient at the hospital very early in the morning, and he is feeling withdrawals. We can see the withdrawals. We can see all the symptoms of the withdrawals, like the nose running and chilling and things like that. And at this moment, what this means? This means that if the patient is feeling withdrawals, it means that he has not a lot of opiates circulating. So it seems that it's safe to take Ibogaine at this moment. So this is what we do. We give Ibogaine at this moment. And it's interesting because a long time before the let's say the effects of Ibogaine start, the withdrawal goes away, because Ibogaine interacts with a lot of receptors in the brain, including some opiates receptors. So when Ibogaine connects with the receptors of opiates, the withdrawal disappears. And after that, some minutes or half an hour or an hour after that, the patients start feeling the traditional effects of Ibogaine. But the withdrawal is gone. Before of everything, the withdrawal is gone. So this makes the detoxification more comfortable than the traditional detoxification.
Oh, that's fascinating. And let me know if this is correct. I've read that Ibogaine, as the shorter acting metabolite compared to noribogaine, Ibogaine is helping more with the detoxification process, but then noribogaine, the longer acting one, is more what continues to work beyond that at recovery. Is that accurate in your opinion?
Yes, it's exactly that. What happens when you take Ibogaine, Ibogaine is transformed, is changed to metabolized to noribogaine in the liver, and Ibogaine and noribogaine goes to the brain. They go to the brain and they do the effects. But noribogaine has an attraction to fat tissues. So noribogaine starts to be deposited. They link. Noribogaine links to the fat tissue in the body, in the brain, in between the organs in the belly. So when you and Ibogaine is going is eliminated by the kidney, but the noribogaine stays in the system, attached, let's say, to the fatty tissue, and is released little by little. So this explains why patients sometimes refer feeling the action of Ibogaine weeks after taking it. Is because the Ibogaine itself is gone, but the noribogaine, its metabolite, it's still circulating in very small amounts, but it's still circulating. This explains the long-lasting effects of Ibogaine.
Oh, fascinating. And so I think You were talking about how you'd switch to a shorter acting opiate from other longer acting ones. And I think you've mentioned before that if someone's on cocaine or crack, they need to get off it for a certain number of days or a month before. Is that right?
Yes, it's right, because there are different effects of these drugs, and one of the effects of cocaine or crack cocaine and other stimulants is that when you stop using it, you have bradycardia. Your heart rate goes lower than the normal, and this is because a phenomena called the QT prolongation. Is a thing that you see in the EKG. You can see that a part of the EKG, which is the QT interval, it's taking more time to happen, let's say. So this reflects what's happening in the body. That is the bradycardia. The heart rate is slower than the normal. It's okay. It's not a problem. And when you are using cocaine and you stop using cocaine, this always happens, but the person doesn't feel it. He cannot feel that this is happening. But it's a coincidence, but Ibogaine lowers the heart rate too. It causes bradycardia too. It causes a QT prolongation, QT interval prolongation too. So if you sum this effect, if you do the two things, if you give Ibogaine in a moment that the person has recently stopped cocaine or crack cocaine, and the person is still under this QT interval prolongation effect, you can have a significant bradycardia, and after that you can have a cardiac arrhythmia that it's called torsade de Pontes, and this is potentially dangerous. So to make the Ibogaine treatment more safe possible, we ask the patient to stop using cocaine or crack cocaine for 4 weeks before taking Ibogaine. When you say that, people feel strange, because they say, why? But I'm talking about taking Ibogaine to stop using cocaine, and you are asking me to stop cocaine first of all. Yes, because it's common for us to see patients that are using cocaine or crack cocaine, and they tell us that from time to time they stay 2 months abstinent, they stay 3 months without using, even not being in a hospital or in a clinic, they can manage to be a long time without using it. So this is what we do. We ask for the collaboration of the patient to arrive here, let's say, clean of all of the substances, to ensure that the treatment will be safe. This is one, let's say, a trick that we use to make the treatment safer. And this is why we never see complications here, because we take this care. So this is an important thing, because only really motivated people agree in doing this and in taking this time and doing this sacrifice. We understand that it's a sacrifice. And it's another thing that it's important. People arriving here, being out of cocaine or from crack cocaine for a month, for 4 weeks, they arrive here with clear minds, and they can understand better the effects of Ibogaine. The reactions that they have are more strong than people that use it few days before. But with opiate patients, as I mentioned it before, it's impossible. It's very complicated for an opiate patient to stay away from opiates for hours. So for a week or 2 weeks or 3 weeks will be impossible. So that's why we do the way I mentioned it. We wait until the moment that the patient is feeling uncomfortable because of the withdrawal, and we start the treatment, even knowing that there is some opiates circulating. circulating, but it works. If you do this with care, it works.
Let's talk about what happens during the experience. I'm so curious, having never experienced Ibogaine myself yet. So you say someone comes in on opiates, they successfully switch to a shorter acting, they take their last dose at night, they go to sleep. If they can't sleep, they wake up early. They're starting to have withdrawal symptoms. They come to see you in the hospital. They get a dose of Ibogaine. Maybe you can walk us through what it's like. What's the set and setting? How is Ibogaine given? Is it a capsule? Like, how long does it take to kick in? And then what happens?
Okay. Yeah. So the patient arrives at the hospital. We ask them not to eat anything in the morning. They arrive with the empty stomach. This helps because it makes the absorption of Ibogaine quicker. And so we can be sure that the patient will not vomit the Ibogaine. So the patient arrives at the hospital. He stays in a room that we have in the hospital that has, he stays alone in the room with no other patients, only him or her. And we stay in a room that is connected to the place where the patient is at bed, but we don't stay inside the room to leave the patient have his privacy, but we are there 3 meters away, and we give Ibogaine in doses that is 15 milligrams per kilogram of pure Ibogaine to a patient that is using stimulants, cocaine or crack cocaine, and 20 milligrams per kilogram to an opiate patient, because the opiate patient, as he has opiates in a little amount but still circulating, he's a little more resistant to the medicine. So we need to use a dose that it's a little bigger. We use capsules. It's capsules containing a powder that is Ibogaine. You could use the powder, mix it in water and drink, but it's very bitter. It's a very bitter taste, so people start vomiting. So we put it in capsules to avoid this, to try to let's say, to hide this taste. And after that, it takes a little time to start working, because Ibogaine, as I mentioned, it needs to go through the liver and being transformed in noribogaine and go into the brain. So around 1 hour after taking Ibogaine, the person enters in the first phase. The effects of Ibogaine, they go through 3 different phases. The first phase is what we call in a specific symptoms phase. The patient starts to feel that something is happening, but he cannot explain what's happening. It seems that the walls are different. He feels that the arms and the legs are a little dumb, and they feel a heat in the chest, a heat in the back. They can hear a buzz in the ears, and it's not a buzz, a continuous buzz, but it's something like wow, wow, wow. It looks like there's a motorcycle or a machine going around the room. It's interesting because although we explain this to the patients, most of the patients get off the bed and go to the window to see what's that motorcycle going. And after that, this lasts for 15, 20 minutes. After that, the patient goes to the second phase. It's the most characteristic phase of Ibogaine, is the phase of the thoughts flooding. The thoughts flooding, a lot of thoughts. The patients start to think very quickly, a lot of thoughts running into his consciousness, and he can't even pay attention to the thoughts, because when one thought arrives and he starts paying attention to that thought, the thought goes away and another thought takes place, and this starts happening very quickly. One day in the future, if one of you take Ibogaine, we will remember me doing this. It's exactly what happens. The thoughts, a lot of thoughts. And after some time, after the patient gets used to this situation, he starts noting that a lot of these thoughts, not all of them, but a lot of them are memories, are remembrances of the past. And normally they can remember from anything from the past, but the most of the memories are from the childhood and from the teenager time, and not in a chronological presentation. So they remember a thing that happened with 6 years old. After that, a thing that happened with 4 years old, a thing that happened last week, a thing that happened with 10 years old. And for 80% of the patients, these memories, these remembrances are so sharp, they are so defined that they can see the memories. When they are with eyes closed, it appears a screen in this black curtain that forms. There appears a screen, and in this screen is, let's say, broadcasting. I don't know if the word is correct, but it's projected. A scene. This memory is being projected in colors, like a TV screen, in colors, and in slow motion. The scene presents in a slow motion, and patients experience with psychedelic, they can even control these images. They can ask the images to go back, like a rewind, and they can ask the images to go forward, and they start to recognize things. They see the images. The most of the patients, they see the images like they had put a camera in the forehead, and they filmed it when it happened years ago. So it's a first-person view. It's not common for people to have the sensation that they are floating in the ceiling and seeing the scene from above. They see what they recorded when that happened. As I always say to the patients, that we are the cameraman of our lives. So they see what they recorded at that moment. So they cannot see what they didn't record it. So if they are seeing a scene, and after that, behind that scene, there's a door, they will never see what is inside that door unless in that moment, in the past, someone had opened that door and they saw it. If the door stayed closed, they cannot see what is inside the door. So they see, let's say, a recording of things that happened in their lives. This goes, this takes around 6 to 8 hours. And while this happens, the patient feels drowsiness, and they feel nauseated. Sometimes they can vomit. They feel some tremors in the extremities. And when they open their eyes, they see nothing. They seem to feel almost normal. But when they close their eyes, they start to see the images again. And after 6 to 8 hours, these screens start to appear, but with no images appearing. They stay, let's say, blank. And after 1 hour, after that, 1 hour and a half, the screens disappear. The thoughts start to run in the normal speed. And the patient enters the third phase. The third phase is what we call the question and answers phase. The patient starts to remember what they remembered before in the second phase. They start to think about it. They normally get very impressed with it because they remember things that were, I don't know the term in English, but really, really old things, antiquated things that sometimes happened with 3 years old, 4 years old, or things that they are not so in the past, but they didn't pay attention to that situation. So they see the situation that they had forgotten, and they start thinking about that things that they remembered, and they start to have insights. They start to suddenly understand things that they weren't understanding, and normally things that are important for their lives and related to their problems and to the situations they are dealing with, relationships and things in the work. It's difficult to give examples because it's a lot individual reactions, and each patient has her story. So, but what happens is that expansion of consciousness, and the patient start to have insights. And normally the patients in this first night, they don't sleep because Ibogaine is very stimulant, and because it seems that Ibogaine mimetizes, let's say, the dreaming. So it seems that the brain thinks that the patient slept hours, a lot of hours during the day because he was dreaming. So he have not need to sleep during the night. But during the first night, all the time they stay at bed and having these insights, these thoughts, understanding things about their lives, about their problems, and understanding what they are doing, that it's good for them, and they must continue to do that, understanding things that they are doing that they are not so good for their lives. So it would be better if they change a little the path they are going through. And then the next day, they are very tired. Everything disappears. From time to time, they may have some insights, but normally they are tired with a little drowsiness, a little nausea, but we release them from the hospital if they are okay, and we ask them to rest for 1 day or 2. But normally, the good healthy patient, normally in the afternoon after being released from the hospital, they are totally okay. They are feeling good. They are normally very happy. Probably because Ibogaine normalizes the amount of neurotransmitters in the brain, serotonin, dopamine, and others. And so they are feeling very well, very happy. And this is the good thing about Ibogaine. These reactions, they last for months after taking Ibogaine, because they are not related to the effect of Ibogaine itself. Like it was an euphoria, for example, if you take methamphetamine, for example, and when your body eliminates the methamphetamine, you start to feel the opposite of euphoria. Ibogaine releases in the brain the GDNF, the glial cell derivative neurotrophic factor. It's a substance that promotes connection between neurons, promotes new synapses to be formed. So this is a thing that lasts, because we don't need Ibogaine anymore. The connections already happened. The connections are already working properly. So we don't need more substances to feel good. So that's the moment when the patient makes a decision. I'm feeling good. I don't need anything outside me to feel good. I will not use drugs anymore. If it's a motivated patient. Because if it's not a motivated patient, sometimes it happens. If it's a patient that it's undergoing Ibogaine treatment because someone is asking him or her or forcing him or her, normally this happens, the craving goes away, but the patient doesn't stop using drugs because he wants to use. It's a very, addiction is a very complex issue. It's not so simple. But what we see is that if the patient really wants to quit, but he or her is having difficulty to quit because of the cravings and of the withdrawals, taking Ibogaine will solve the problem, because the withdrawal will go away, the craving will go away. But sometimes this not happening because there are more profound issues that must be addressed. So that's why we think that Ibogaine, we treat Ibogaine like a psychotherapy facilitator. We don't think that Ibogaine is a miracle drug and will solve all the problems by itself. It will help the psychotherapy and the psychotherapist to do their work, but it will really help because the person has more clarity after Ibogaine of what is happening with him or with her.
Amazing. Well, sign me up. I would like to go into this eyes opened camera review of all the memories of my life where I can control it and my thoughts are going wild. So that brings up a real question, though. Do people do this for fun? I read this case report that said, I wouldn't recommend Ibogaine to someone who's trying to have fun. If you want your body to explode into 1,000 pieces and rebuild itself into something beautiful, then yeah, but don't expect it to be pleasant. Would you agree with it being difficult for nearly everyone?
Yes, it's not difficult for everyone. It depends on what we have inside us. So from some people, it's a very difficult experience with bad memories and things like that. But for the most of the people, it's not a bad experience. And the things that come up to the consciousness are good things, are good memories. But it's uncomfortable because you have nausea, you have a bad feeling, you feel uncomfortable. So interesting, when we finish the treatment and the patient will be released from the hospital, the most of them say, oh, I like it, Ibogaine, I feel that it will help me, but I will never want to take it again because it's very uncomfortable. And there's no cases of addiction to Ibogaine related in the medical literature, exactly because of that. It's not a pleasant experience. It's interesting. It brings you benefits, but it's not pleasant. It's uncomfortable, and sometimes patients ask us to stop the experience. They say, "Do you have a shot that you can give me, a medicine that you can give me to stop this feeling because I'm not dealing well with that?" Most of the times, the patients that ask that are patients that are not properly prepared for the experience. Is that patient that are not taking seriously the psychotherapy and things like that. So when they arrive, they have no idea, they have the exact idea of what will happen. So they get scared with the memories and things like that. But what we do is to try to calm down the patient, to stay with them, to be there for them. And when they calm down, they goes into another, let's say, another part of the experience, and other memories came up, and they can go and leave these bad memories behind and go forward.
Steve, are you in? Should we do an episode down in Brazil?
Sign me up, man. I don't have any addictions to any substances. I wonder what the Ibogaine experience would be like for somebody who maybe doesn't have a substance use disorder, but has post-traumatic stress disorder or obsessive compulsive disorder. Is Ibogaine used to treat other psychiatric conditions besides substance use disorders?
Yes, it can be used, but in the day by day, we don't use it to other issues because this is the problem of regulation, and we see that the Anvisa, for example, they accept very well the fact that we are using it to addiction because there are no other options to do it. They are not good medicines to do it. But for other issues like depression, like PTSD and things like that, we know that Ibogaine works. Sometimes people ask us to do it for depression, and it works very well. But as we have not published papers about that, research about that, we try not to do that. We try to stay doing only addiction treatments, because this is a treatment that we have some evidences that it works. We have the experience, and it's acceptable by the government, by the regulatory agencies. So we stay with addiction, but it works very well with depression, works very well with obsessive compulsive disorders. That's it. Let's say things that are caused by an imbalance, a disbalance. It's that correct? A disbalance of the neurotransmitters. So Ibogaine corrects the neurotransmitters balance, so it's okay. And it seems we need more research to that, but it seems that Ibogaine works with Parkinson disease too. But this need more research. Even for addiction, we need more research to understand better its ways of action, understand better the moment, the ideal moments to do it. But as addiction is a very complicated problem to treat with other medicines, we feel that we are doing the right thing, using it, even with having all the papers done, because if you wait all the research to be done, we will never do the treatment, because we will never be satisfied with the research. There will be always some doubts that we will have.
True. I'd love to study it for some of those other things one day, including eating disorders. Like anecdotally, I've heard people who have reported healing or attaining recovery from their eating disorder with the help of Ibogaine. But one thing I wanted to just bring up as a little tangent, because I found it so interesting when I heard the modern history of Ibogaine it was a conversation with Hamilton Morris, and I didn't really appreciate this fully before, but Hamilton, of course, knows a lot of things about a lot of medicines, including some fun historical tidbits. But he pointed out how it was in the 60s when this kid, a 19-year-old in New York, Howard Lotsof, happened to be friends with a chemist. He was hooked on heroin, but he was actually just asking for a psychedelic. And the only psychedelic the chemist had was Ibogaine. So he's like, here, try this. It'll send you on a trip. But then while taking it for a trip, he ended up just coincidentally losing his craving for heroin, but not only losing it, like the way he conceptualized it changed. He started to think of heroin as like a symbol of death, something that he definitely did not want to take into his body. So then he gave it to 6 of his friends who were addicted to heroin as well, and 5 of them immediately quit. Fascinating how these things emerge, like from just anecdotally like that, and then we get into the research, of course, and take it from there.
Exactly. I met Howard Lotsof. He was a friend of mine. I was very honored to be his friend. And in the beginning of my work here, he helped me a lot. In the beginning, we used it to connect by Skype, and he helped me when I had some doubt how to deal with situations. He died in 2010, I think in January of 2010. And one of the people that he gave Ibogaine was her wife, Norma Lotsof, who is alive until now. Coincidentally, at this moment, she is at a meeting, an Ibogaine meeting in Amsterdam. It's happening at the same time that we are talking now. And exactly what this happened. And he was totally amazed what Ibogaine did with him, because suddenly 24 hours after taking it, he was not feeling craving anymore. He was not feeling withdrawals anymore. But it took almost 3 decades to find someone to to start researching it in United States. And until now, it's difficult to find someone to research Ibogaine in the United States because it's a Schedule 1 substance. Mm-hmm. So people are afraid of working with that, and it's difficult. It's very bureaucratic to work with that. But this is the difference from Brazil. In Brazil, it's not forbidden. It's not even scheduled. We have a scheduled method that goes from A to F, with F being the most problematic substance, let's say, and the opposite. A is being the most problematic substance, and Ibogaine it's not scheduled in any of the categories from A to F. So it's okay to use Ibogaine. It's important to say that Ibogaine it's not scheduled in Brazil and not scheduled by the United Nations control. So it's easier for us to import it and to use it. There are some resistance, it's true, and the main resistance comes from clinics that work with addiction because they cannot understand why they will use Ibogaine and have the patient in a inpatient basis for 24 hours when they can have them in an inpatient basis for 9 months. So it's a commercial problem. They see the advantages of Ibogaine, but they see disadvantages of Ibogaine because of the quickly answer that Ibogaine evokes. So this is our problem here. It's not a regulation problem, but a political problem because some people don't like the good effect of Ibogaine. But this is normal, and every time in the history of the world, when you come with a new thing, a new method, the people that are working with the old method, they don't like. I'm sure that when they invented the cars, people that worked with that horse-powered transportations, I don't know the name, they probably didn't feel happy, but it's normal. It's the normal evolution of science. So, and I always say that, okay, you don't want us to use Ibogaine. So what will we do with this lot of kids and people using drugs and wanting to get out of drugs? Because if a person is using drugs, but they want to stay on drugs, it's okay. It's a decision that an adult can have. But when people want to go out, to stay out, and they are not being succeed in that because it's complicated, because the drugs really makes a change in their brain. So we must be there for them and help them to get out. And if Ibogaine is a thing that works, and we can prove that it works and it's safe, if we do it the proper way, following the proper protocol, why can't we use that? Why can't we do that? So that's the explanation. This are the things, let's say, that we tell people. We talk with the government and we talk with the regulation people, and they understand. When we explain, they understand, and they even help us in promoting that and using that. What we are trying to do is to do a phase 2/3 research here to send to our FDA, Anvisa, and Anvisa accepting this, the Anvisa will register Ibogaine. They will recognize it as a medicine. This will allow us to import it with less bureaucracy than today, and it will drop the cost, and it will be more accessible to people. And we have here in Brazil, let's say, a good reception. Anvisa is open to talk about it and to help us, since we do it exactly the way they want to do. We are working with Anvisa in a way quite similar to MAPS, like MAPS is acting with MDMA, respecting totally the FDA regulations to make it approval. It's exactly what we are doing here with Ibogaine.
That's amazing that you had met Howard and his wife. I found it so inspiring to look at his story, how he started a nonprofit named after his grandmother. He got a drug company to make it for a while, and then got a Swiss or Dutch psychiatrist, Jan Bastians, who had done work with LSD and Holocaust survivors to do some research on it. But one piece of the history I don't really kind of understand is Ibogaine for a time was sold in France under the brand name Lambarene, like in these 8 milligram tablets. What was it for then? Do you know?
Yes. What happens is that Ibogaine, in very, very micro doses like that, 8 milligrams. Remember that I mentioned it, that we use around 20 milligrams per kilogram to treat heroin addiction, for example. But in a dose, in a capsule with 8 milligram, it has an energetic effect, like a booster of caffeine, for example, like an energetic drink. So, and as France was the country that colonized Gabon, where is the main source of the plant, the Tabernante boga plant, which Ibogaine came from, they had influence, they had this contact, and they heard that people in the forest were using small amounts of Ibogaine to get energetic. They started to produce Lambarene, which was energetic. It was a tonic medication, and it was sold in drugstores without medical prescription. And people were using it to study. They were using it like people use Ritalin or this stimulant. People were using it to study and to stay a little more time without eating and things like that. But what happened was that the French team of snow skiing, they used Ibogaine as a stimulant to the competition, to the Winter Olympics, and the government detected that, and the reaction of the government was, instead of regulating it, forbidding it. It was I think that they thought it were more practical and easier to forbidden than to regulate. So Lambarene disappeared from the market. But there are people that benefit from taking these small amounts of Ibogaine daily. People that have depression, people that have Parkinson's disease, they benefit from taking this microdose every day for 60 days or 90 days. I have seen patients taking these small amounts every day with depression, for example. I and some friends, we published a paper about that, about depression in a bipolar patient that we treated with this small amount of Ibogaine, and it worked very well. So we need more research to understand how this works and why this works, and to, as I said, to make this medicine available to more people.
Amazing. Well, Steve, I've been hogging the mic because I find this so fascinating. What do you have from your end? Any curiosities? I know time is whizzing by.
Yeah, we're coming to the end of the hour we set aside. Bruno, I'm curious. We've been talking about primarily opiate and stimulant addictions. I've heard that a lot of folks who have addictions to alcohol also find Ibogaine treatment very, very useful. Do you have any experience with alcohol abuse disorder patients and Ibogaine?
Yes, we treat patients with alcohol abuse disorder, and it works very well too. The only detail is that as alcohol is toxic to the liver, we have to pay a little more attention in the situation of the liver of this patient, because ibogaine will be metabolized in the liver, so the liver must not be completely destroyed, because we need at least 50% of the liver function to be sure that ibogaine will be transformed will metabolize it in noribogaine for the treatment to work. And it works too with non-chemical addictions like eating disorders, on people that have a compulsion to gambling or to buying, or sexual compulsion. From time to time we treat people with these problems. And interestingly, the thing that ibogaine works not so as good as the other things is smoking. Ibogaine is not so good to treat tobacco smoking. It's not so good. So when a person seeks for ibogaine treatment for smoking, we normally try to do other treatments, more conventional treatments before taking ibogaine, because we see that only around 50% of the persons quit smoking. And we did a retrospective study some years ago with ibogaine here, with alcohol, cocaine, and crack cocaine, and we achieved a 72% result efficacy with a single dose of ibogaine. So it's comparing to the normal treatments, it's very different. So that's why ibogaine really has its place in the treatment of addiction. It really works, and for some people it works very, very good, very well. It's not uncommon for me to suddenly receive a message from a patient saying things like that. Hi Bruno, today it's my ibogaine birthday. 10 years ago I was with you in doing the treatment, and 10 years after I'm still okay. Thank you very much. Thank you, ibogaine. And thanks to ibogaine, I'm doing nothing. I'm only facilitating the access to ibogaine and taking care of the patients during the ibogaine effect. What does the thing is ibogaine. Ibogaine is really a great molecule, and it needs a lot more study, because I think it has a lot of possibilities for us to discover.
You mentioned ancient use and how that the indigenous tribes in Gabon were using microdoses for the stimulating effect. Did they use bigger doses? And if so, what for?
Yes, there are two situations in Gabon where they use ibogaine. The traditional situation is they have a religion called Biwiti, and this Biwiti, they believe that ibogaine changes young people, teenagers, in adults. So they use it when the teenager reaches 17 years old. They have a big party with high doses of ibogaine consumption. We don't know exactly the doses, because they use ibogaine in the root in the root form. So we cannot measure how much they are taking, but they are taking a lot of ibogaine. And after 3 days under the effect of ibogaine, they declare that the teenager is not a teenager anymore, is an adult, and he starts participation in adult activities. But as they see that ibogaine is the sacred plant, they use in the day by day for everything. So when they have a hurt in a wound in the skin, they take a little amount of the leaves, and they use as a a curative in the wound. If they have stomachache, they eat a little amount of the root or a little amount of the leaves to alleviate the stomachache. So they use it in these small amounts, and they use it in small amounts too, in a microdoses, to hunt, to go hunting, because it works like cocaine works or worked to the people, to the native people in Peru and Bolivia, the ancient people there. They used cocaine to go to long trips by foot, to diminish the hunger and to feel more energetic. People in Gabon uses Ibogaine in the same way, to have more energy and to not to have to bring a lot of food to go hunting. So they use in this context.
It's amazing. I talked to some people who went out, traveled out, and observed and even did some Bwiti ceremonies. And one method that a friend experienced said, like, they start with a little spoon of iboga, like in the rainforest. This is Gabon Bwiti tribe. And then they do a few days of rituals. So they're like cleansing, preparing for the big dose. And then it's like initiation night. You keep getting fed iboga until you purge sometimes in some traditions, and visions come on, and they're still increasing the dose. It's like a 18-hour trip, but then they're given a name, like it's called your combo. And then like one more spoon for a ceremony that's your rebirth, your like formal initiation, dancing, music. And then when it's done, the iboga, the vision, the journey is like your lighthouse guiding you through life. And once you integrate the message of your combo, your new Bwiti name, into your life, your initiation is complete. But that part can take years. Like you might have done a few day journey, but then the formal initiation or integration might take a while after that. I found that kind of fascinating comparing to how we think about integration here and the work that's after the trip.
Exactly. And I think it's interesting to talk about is that the difference between Iboga and Ibogaine, because Iboga, the traditional preparation, has the entourage effect. It's not only Ibogaine there. Yeah. There are other alkaloids that are mixed and they get the entourage effect. Yeah. And what we use here in the medical context is pure Ibogaine. It's a medicine that is produced under the good manufacturing practice, because as I mentioned it in the beginning, we respect the use of traditional Iboga. It's very fine. Oh, yeah. They know a lot of it, but we cannot use it in the medical context. So we use Ibogaine, the pure Ibogaine.
Yeah.
Well, I'm really glad that you shared the indigenous use, because the rites of passage, like the one you described, is something I think that we are missing, sadly, in the Western world in a lot of ways. Yeah. And I have a reverence for the use of psychedelics in all these different places in the ancient world for those purposes, for ceremony, but rites of passage in particular. It's really moving to me.
Exactly. And they know, the traditional healers, they know a lot about it. Maybe they know a lot more than we know, but that's the way that it's possible to work here. Because here, I mean, in the Western world, because other ways will not be recognized and people will have less access to the medicine if we don't feel in the way that these health regulators want us to fit, in the trail that they want us to fit.
Right. Yep. Yeah. We have to act within the constraints that exist so that we can do this work. It's insane to me that something like Ibogaine, that no one would want to take for fun, as we were describing, would be a Schedule I substance, right? It's not something people are going to abuse, and that used, as you've described, Bruno, in the correct medical setting, with all the attention that you're giving to those important details, it's an incredible medicine. Is there anything that you want to share with our audience that you haven't had a chance to share that you think might be interesting for them to know about Ibogaine?
Yes, I want only to reinforce that saying that it's safe to do Ibogaine. You can have very important benefits from it since you use it in the proper protocol, following the proper protocol. For everything in life, we need to follow protocols. To drive, we need to follow a lot of protocols that we follow automatically. We don't even remember that we are doing it, but buckling the seat belts, and driving the way that's right to drive, paying attention to the traffic, things like that. To use Ibogaine is the same thing. You must follow some medical protocols to be safe. And doing that, it's safe to do. And it's a lot more unsafe to do heroin, for example, than to do Ibogaine. So this fear of Ibogaine, I want to slowly, with my work, with our work here in Brazil, I'm not working alone. There's a lot of people working with me. We want to show to people that it's okay to do it if you do it the right way. If you will jump from a plane with the parachute, you follow a lot of protocols, and you will take some medicines. We follow a lot of protocols. So when we take Ibogaine, we must follow the protocol. It's not, if you have a gallbladder problem, for example, a calculus in the gallbladder, you won't make a surgery in your friend's house, in your friend's garage with the knife that you use in the kitchen. You will look for a doctor, anesthesiologist, a surgeon to do it the proper way. Ibogaine, we need to do it the proper way. So it's safe to do that. The problem is that Ibogaine really works well, and sometimes people not so well prepared wants to facilitate Ibogaine treatments, and at this moment things may go not so well as planned. So each one must take care to do it the way that it's meant to be done, and it's okay to and it's safe to do that.
Thank you, Bruno. It's been fascinating and very informative. I know I've learned a lot. We'll have to continue our conversation and collaborations, and hopefully make a trip out to visit you or see you at a conference.
Yes, you are totally invited to be here. It will be a pleasure and an honor to have you in Brazil. Just let me know in advance for me to prepare some things here to have you here. But it will be a pleasure to have you here.
Thanks, Bruno, I don't think I asked, what's the name of the hospital where you work?
The name of the hospital, I live in a small city called Ourinhos. It's near São Paulo. And the name of the hospital is Santa Casa de Ourinhos. It means Holy House of Ourinhos, because it was a hospital that in the past was run by priests and nurses. Mm-hmm. So it's the Santa Casa. It's a public hospital. It's a philanthropic hospital. But when we talked with them and we showed Ibogaine effects, and they asked all the regulators, all the authorities, and they gained confidence that we could do it legally, officially. And I'm doing this treatment for 4 years with them. And I am proud of it, and they are proud of having this treatment in their hospital too.
Wonderful. Well, thank you so much for joining us on the podcast, Bruno. It's been a pleasure.
It's a pleasure for me. Thank you very much for the opportunity, and hope in the future we can be together again.
Yeah, take care.
You too.
Thank you, dear listener, for listening. It means a lot to me. If you like what you heard, please subscribe to the podcast on whatever platform you're using to listen or watch. Also, if you're feeling generous today, please leave us a glowing review on Apple Podcasts, Stitcher, or wherever you like to listen. Thanks again. The content of this podcast does not constitute medical advice or mental health treatment. Consult with a medical or mental health professional if you believe you are in need of mental health treatment.